Hi guys, Rashid here from IU Media. Today I'm with a special guest. He is a doctor by profession. Welcome to the show, Dr. Vinod. Dr. Joseph is in. Yeah, so it's Vinod Joseph.
Vinod Joseph.
Yeah. So a few things I'd like to ask you, Dr. Joseph, is how you developed your career, and firstly, like where you started, where you studied, and what influenced you to get into the profession of medical.
So I did my medicine back home in India.
It's popular over there, isn't it?
Yeah. I mean, in those days we had, I come from the state of Kerala, which is South India, and education is very, it's one of the top literacy states. We have 2-3 districts which are 100% literate. And when we come to college level, always we are sent on the lines, either you go into the engineering field or the medical field. So I had done both maths and science in school, so I could go either way.
Then you came to UK in 2000, and then were you a consultant then, or were you just...
No, I had just finished my undergraduate medical schooling, and then I worked there for a few years. I did my housemanship and I worked there for a few years. And by that time, there was a big exodus of doctors from all over the world to come to UK, because here the NHS, they needed people, and so I came like that, and I was one of the last guys in our batch who came here. Everybody had come even earlier.
Okay.
So when we finished medicine, many of them came straight away. I worked there for 2-3 years, so that's why I got delayed.
Did you want to come first, or?
In those days you didn't think like that. So once you started working, you saw it's no good here, and then all these guys have gone, and they said it's much better opportunity there, and so that is how the
so that's what made you decide.
Decision to go. Yes.
So you never had the thought in your head before?
No. There was no such. You are always thinking.
Did you think to go abroad at any point?
When you finish medical school, you wanted to first see what was the situation in India, but then in those days I don't think things were that open.
Okay.
That you could. Now if you talk people, it doesn't make sense to people, because they don't realize things. Like I said, now the world is like global village. Travel has become so easy. You can go wherever you want.
Yeah.
But in those days you didn't think, because it was not that easy to
because
go
you're talking,
to.
Like nearly 20 years.
20 years,
yeah.
Yeah,
it's a long time.
Long time, yeah.
And then, so you've been here since then. So when you came here, did you have to do another course when you came here again?
So initially, when we come here, we have to do a licensing exam. We have to pass that exam, and we have to do an English test, both of which we have to pass. Only then we are allowed to work in this country.
Okay.
And this test has both written and a practical
Test,
yes.
They still do the test now?
Oh yes, they still do.
Is it the same, or has it changed?
No, it's still the same. I don't think you have so many people doing it as it was in those days. Yeah.
Oh, is it?
Yes, it was a huge number of people were doing in those days. Yeah.
Because the NHS don't need as many.
No, it's not only that. I think now they are kind of saturated here. They still need doctors, but things in other parts of the world have improved. So it's not. There's not much attraction to come here. Before, things those areas overseas was not that great, and people always wanted to go abroad because NHS was a very good system. But now they think even those countries have improved so much, there's no incentive to come here.
And even NHS is changing as well.
Oh, NHS is changing. I don't know if it's a good thing or a bad thing. I always believe NHS is one of the best system, because everybody gets free treatment, and it's the same for everyone. So it's one of the best. The concept is very good, but the way the funding and the hospitals all running short-staffed, and I think that has a big bearing on the general outlook of the NHS. People are always very stressed, and the work atmosphere is not good, and
So
the care
there's-
is dropping, levels of care, and even training. I feel personally from the time I came now, I wouldn't be confident of a junior who's working now till I see how much he has advanced in his career to know that he has
He's
achieved
fully
a
competent, yeah.
competent. Yes, yes.
So the competency level, how would you measure this?
I mean, you have lot of you have objective and subjective. You do by working with them.
I'm assuming you train a lot of the doctors? as
Yes,
well?
yes, we
Yeah.
have from medical students. We work with junior doctors, and so training is a part of NHS. Yeah.
Yes.
So they come and shadow us. They during the ward rounds. They are there in with us during the clinics, and then there are regular teaching sessions in the hospitals. Yeah.
Yeah.
So you have weekly like a educational meeting for doctors. You have a grand rounds where different doctors from different departments will present cases. So there are a lot of educational opportunities. But I think just the way the educational system has streamlined and gone, I think people are losing that focus, and it's becoming a service where everything is dependent on the consultants. The juniors are just being like spoon fed, which I don't think they will really you learn when you do it yourself. I mean, if somebody spoon feeds you,
Yeah,
you're not going to
for example, you're saying they're learning but they're not understanding.
understanding. Yes,
Because these are two different things.
do different things.
The only
yeah.
way you understand
And
is
it's
through
when
the
you
practical.
yeah, absolutely.
Yes,
Yes, yes.
And then only when you understand you can do something fully practically
Practically,
anyway.
yes, yes.
And through experience, that's how you gain the understanding.
Yeah.
Is it because of the opportunity, or is it
No.
because from what you said, like NHS is still short staffed and a lot of strain.
It
So why
is-
wouldn't they get the?
The thing is, because nowadays I think the culture has changed. There's a lot of legal aspects, and everything has how can I put it, I'm looking for the word, politically correct. And so years ago where you would do some things which now you can't do, and the juniors are like they even to make a simple decision, they don't use their head or common sense. They will wait, oh, this decision has to be made by the it's a totally different approach. Whereas in those days, you are under stress, you are working
just do
with
it, yeah.
this thing, you just get on with it and you do it, and that's how you learn. Now you
Too
come
many rules and procedures in place now.
procedures, and it's more medical legal issues that people are not getting the time for really experiencing the work atmosphere and learning from that.
Right.
Of course, they will shadow and do that. Go with the consultants, go with the doctors, senior doctors on the wards. But that's why I meant to say that is just you can always learn a little bit, but not to the full extent. Once you take it up, okay. First, when you come to a place,
So the responsibility isn't being passed over to them.
yes,
That's what you're saying.
that's exactly what I'm saying. Yes,
And the only way they're going to gain more experience is by taking on more responsibility, but the processes contradict
it is
itself.
Yes.
So the process
With juniors nowadays, I have they come into.
I have another question. Is there a lot of doctors still coming from abroad, or is there a lot that are moving from the UK itself?
I wouldn't say from so in the UK, a lot of consultants moving abroad because of they are getting better job opportunities and better wages and
Even the migrant ones as well.
yes, because they are
So
getting
the UK
better.
is losing doctors.
Yes,
anyway.
absolutely. After training, and they are losing abroad. Now the doctors coming to the UK from abroad, it's not as they are still a number, significant number, but it's very tiny compared to what it was during the time when I came. And government is doing a lot here to increase the number of doctors. So they are doing that is a good thing. But I think the way the training has been streamlined, and there's again with the General Medical Council and the various bodies which they have changed the whole training pattern. So it's not the same what it used to be.
So even for those doctors to progress is going to be difficult then.
No.
So it'll take longer. It's a longer process.
It is a longer process, but they had tried to make it cut short. And for example, a GP VTS training, they try to do it within 3.5 years. The hospital medicine, once you come to a registrar, they are cutting it down to about 4 and 5 years, so that they finish the registrar training within 4 and 5 years. But again, it's all very streamlined, and they're trying to make it go very soon. But I guess even before they reach that training level, what experience they get is not as good as what it used to be in those days.
So if there was somebody who was training to be a doctor, and during their studies while they're training in the hospital, do they get paid something?
As a medical student, I don't think so. But definitely when they start their housemanship, they get paid. Yes.
They get like apprenticeship.
Oh yes. They get a proper pay.
Yeah.
So when you're in your final years, you start shadowing the houseman. So modern word for a houseman is no longer for houseman. It's called FY1. Those are the junior most doctors, and then you have the FY2s, and then you have the CTs, which are the core training doctors.
So it takes about approximately 27 years or something by the time you get your.
Yeah, so now you do 1 year of FY1 and FY2, so that's 2 years, and then a couple of years in the core training, that's another 4, so total of about 4 years, and the registrar year is another.
Sorry, I think so. You will do your bachelor's.
Yeah, your medical schooling you do about 4.5 years.
Yeah,
and then you do about 2 years your FY1, F2 years,
which is equivalent to a master's.
I wouldn't say necessarily it's a master's.
Because I'm not too familiar with how the medical.
Yeah.
So I know like you do your A levels and then you go into medicine school.
Yeah.
And then like
you do the medical schooling.
If you go to business school, you do your bachelor's of.
Yeah.
And,
so when you do your medical schooling, you're a bachelor.
Yeah.
So you finish that 4.5 years, and then it's the training. As a junior doctor, and that'll be your first year, second year, so that's a FY1, FY2,
which is equivalent to the masters.
You don't get any degree then. No, you're just getting a title as a first year, second year.
Yes.
And then you get the core training. So there you start.
So that's the CT.
CT, yes. So that is when you decide what is your specialty for, if you're going to the surgical specialties or the medical specialties. And you do a couple of years there, and then you go into the registrar training program of your choice.
Okay.
So if you want to become a surgeon, you go into a ST. So that's called Specialist Training Registrar.
Right.
So that's another 4 years. Or 5 years. They're trying to cut it down to 4 years, but it's usually 5 years. When you finish that 5 years, that is what UK was world over it is recognized, which is called the CCST. That's the Certified Certificate of Fellowship Training.
Okay.
Specialist training. So that is what you get.
If you chose a different direction, like neuro.
Yeah, whatever specialty you choose, that is what you do.
There's so many.
Yeah.
How many is there to choose from?
Oh,
is there about 10 or more?
There's more. There's more than
so,
so you have a lot of surgery. So in surgery you have orthopedics, you have ophthalmology, you have ENT, you have neurosurgery, you have colorectal surgery, the gastroenterology.
So there'll be a good 100
Oh,
plus.
loads of specialties. Yes. And the same thing goes for medical fields as well.
And do you mind if I ask which one did you specialize?
So my specialty is diabetes and endocrine. It is endocrinology, so that's a medical specialty. But diabetes is a condition which is on the rise. So in terms of jobs, there are a lot of opportunities.
High yes. So in terms of like once you, for example, let's say you trained as a specialist in something else.
Yes.
If you wanted to transition into what you're doing now? Would you have to retrain or just do a small course?
So that's the.
You don't have to do the 5 years again, do you?
No, but if it depends. So if
You would build the skill set.
No? It depends. If now, so when you finish your CCST, that's your 4 years of your specialist training, you become a specialist in that field. So a specialist, for example, in my case, it will be a diabetologist and endocrinologist.
And that's when you become the consultant?
Yeah, when you finish this training, then you apply for the consultant jobs.
I see.
But now, if somebody else wants to do this, he will have to go through that 4-year training program to get become a specialist in that field.
But the difference is, while you're going through that training, you still get paid, isn't it?
You do, yes. It is you are
because
providing service.
It's a working.
Working. You're providing service provision at the same time. You are getting experience in that field.
Yeah.
And then you have to do your self-learning with seeing and reading and all that.
Which is what takes the
part
time.
of, yes.
So
and you have exams in that 5 years which you have to complete. If you don't complete that, you won't be getting the even if you complete the 5 years, you won't be eligible to get the certified training certificate.
Yeah, so the exams you have to accomplish, of course.
Yes.
So reality is you do your bachelor's,
which is 4.5 years.
4.5 years.
Then 1 or 2 years in your FY1, FY2 years. So that's about 6.5 years.
7 years. So after 7 years, and
then you have your core training, which can be about 3 years.
You start getting paid on core training.
No, you start getting paid just when you finish medical school. When you start with the FY1, from then on you are paid.
You can start to get paid.
You
still during your training, you're still getting.
You're getting paid. Yes,
yeah.
Absolutely. So after medical school, when you start working, you get paid.
Yeah.
So that is 4.5 to 6.5, 7 years. 3 years of the core training, that's 10 years, and then 4 or 5 years of the specialist registrar. So that is total 15 years.
And you don't be called a doctor during the FY1, is it?
I mean, you are called a doctor, but you would be called a junior doctor.
Junior doctor.
Okay. So they are the ones who will be dealing with patients on the wards.
I see.
So if you have a surgical ward, the junior doctors will be,
the
consultants will come and supervise them, and their registrars also will come and give them help in times of need. But they are the ones who are running all the wards.
Once they've done that, they can. So it takes 5 years really then, isn't it? So after 5 years they step in, and to be fair, they're almost guaranteed a job.
Oh yes.
Because the demand is so high.
Yes,
so it's a good path to.
It is a good.
Medicine
is always a very good. Whatever happens, I think medical specialty is very. People are being put off because the high intensity of work and the work pressures. But I think it's always a good job because you're doing it's a noble profession. You're doing service, and you will never have a problem finding jobs. Job security will always be there.
Just do you know about the homeotherapy or something? Is this familiar?
Homeotherapy is a different field. It is not similar to allopathic medicine. It's a different field. Yes.
It's still in the medical field, or
it is a type of medicine, but it's not exactly allopathic medicine.
Okay. Also, that's why it's called
homeopathic. Yeah. So they use different types of medications, and it's a totally different system.
So it's a way to develop medicine, isn't it?
It is a way to develop medicine, but the drugs we use and what homeopathy uses are totally different. Yeah, but
when you test it, you know.
A lot of stuff have steroids, which we are anyway using in allopathic medicine
as well.
Yeah. So steroids are very powerful drugs. They are immunosuppressants. They suppress your immune system, but they have a lot of other properties like the anti-inflammatory property, so they reduce inflammation. So they will work irrespectively for most of the things.
Yes.
But at the same time, they'll cause a lot of side effects, like they raise your blood pressure, they cause your sugar levels to go high, they cause fluid retention. There's a lot of side effects. They crumble your bones. A lot of side effects,
Yeah, so that's why steroids are bad.
That's why on the long run, steroids are very damaging. Yes.
Yeah.
So unless you really need it, it's not required. You shouldn't be taking that.
No, and that's why you see like some of the bodybuilders, they go through
Yeah, they use a different type of steroids just to get that physique and bulk and up. Yes, that's anabolic steroids. Yeah, that is even much more potent and more dangerous. Yes.
Ah, it's more dangerous.
Yeah, oh, yeah.
That's why it's kind of illegal, isn't it?
Hey, it's not illegal. You can use it, but it's you're doing it at a very significant risk. You can damage your kidneys. You can damage your heart. You don't know what things are they put in these things. So these things are used to give you the kick and the high, and they become very addictive. And then especially people want those big bulky bodies, they go for this, but then it makes you addictive and you keep on taking it, damage your heart, damage your kidneys, things like that.
So you could be short-lived as well.
Oh
isn't
yes,
it?
absolutely.
Easily.
Yes,
Yeah.
easily. Yeah.
Wow, that's very dangerous.
Yeah.
I didn't know that. So I knew it was dangerous, but I didn't know how
Yeah,
it
yeah.
affects.
We have seen people who ended up using these and coming with heart attacks at such a young age, kidney failure, a lot of things.
And you know, from by asking them, they tell you that they.
But yeah, when you go through the history, that's
You
how
can
you
just-
get these things.
Yeah,
Yes.
yeah. So you can check from the blood as well, isn't it?
Some of the things you come from blood tests that helps us give us a clue, and then you take a targeted detailed history, and then you come to know about that.
So thank you very much for the talk, Dr. Joseph.
My pleasure.